You always say that I'm your whole heart. I believe you, and so does the American Heart Association. That's why this American Heart Month, they want to make sure that you and every other parent know CPR to make sure you are ready. Ready to save my life when it matters most. Learn CPR today so you can be ready and become a part of the nation of lifesavers.
If the time
Good morning and good afternoon, everybody. Welcome to Changing the Future of Health in Black Communities. I'm Katrina McGee, Chief Marketing Officer of the American Heart Association, and we are so delighted and grateful that you have joined us today. Y'all, you are in for quite a treat because we have a dynamic panel we have assembled to talk about how to tackle today's toughest challenges together. Now, listen, I know there's a lot of change in the world, and y'all are like, oh my gosh, there's so much going on. It's chaotic, it's confusing, it's overwhelming. And yet, this is a clarion call, y'all. This is the moment for us to come together and be solutions driven so we can change the narrative around health in Black communities. We believe that this is going to require a multi sector approach. And that's why we are so excited about bringing media, public health, community organizations together so we can affect change. Now, listen, part of the experience is your participation, your engagement. So I know you will join us in the chat. I know you will be a part of this discussion, and you too will think about how we together can come together. And also, I am delighted, peacock proud to introduce our moderator for today. Y'all, she is a bad mama jamma. Y'all know her as Sybil Wilkes, the voice of reason on the Tom Joyner Morning Show. She brought us news and content with integrity, passion, and relatability. Now, as the executive director of Black America Web, she continues that across channels, giving you the news you need in a relatable and resonant fashion. I am delighted to introduce you, Sybil, and welcome you as our moderator.
Thank you, my sister, Katrina. I am so proud to be here with you and to continue our relationship with the American Heart Association. It really is a great day, and I think that you and your crew should be very, very proud of putting this together and bringing this information to all of our viewers and listeners today. As we like to say on the What We Need to Know newsletter, we are here to inform and empower people. And we need all the information and we need the guidance that is available with our expertise here today. So thank you, thank you, thank you so much. And I'm really excited, Katrina. I think we should put out the call and asking people, where are you? How are you watching us? How are you listening to us? We want to hear you. We want to get input from you. Call Mama and them and tell
Yes.
them that we need you to watch because this is about our health journey. And we are going to give some great information and also some help to those who need it. So let us get started with this. I appreciate it, Katrina, as we move on and talk about this particular event. Our goal today, obviously, is to strengthen the relationship between public health and media, particularly as it relates to us in the Black community, and also broaden the collaboration so that more people, more of our people, will be able to live longer, healthier lives, those that look like us, right? And so let us focus on the science. We have two incredible science of science, and that is Dr. Keith Churchwell. He is the president of the American Heart Association for this year. Welcome, Dr. Churchwell. As president, he is the chief volunteer, scientific, and medical officer of the association, and he provides the oversight of medical, scientific, and public health matters and related public policy. Thank you so much, Dr. Churchwell, for your leadership and for joining us today.
Glad to be here.
As well as I'm glad to be reconnected with Dr. Regina Benjamin, the 18th Surgeon General of the United States, and she is now the founder and CEO of the Bayou Clinic. Now, during those years, she provided the public with the best scientific information available, and we've been talking and kind of gleaming some of that information from all of our experts today as we were preparing for this event. So Dr. Regina Benjamin, welcome in and thank you for joining us.
Thank you, glad to be here. Thanks.
It's a pleasure to ask both of you these questions. And so let's start with this, giving an overall picture. In general, what is the health of our Black communities and how does it compare to the general population? That we're talking to Black folks today and about Black health. How do you see this, the overall health of our community? Let's start with you, Dr. Churchwell, as head of the American Heart Association.
Sure. Glad to try to inform. I hope I don't actually overwhelm you with a blizzard of statistics, especially given the weather in the Northeast as we go forward. When we look at the data is striking. A little good news, when you look over the past 20 years through the efforts of the American Heart Association and many others, there's been a noticeable and persistent decline in the death rate from cardiovascular and cerebrovascular disease across the country. Although there was a significant uptick with the pandemic, and we're still trying to recover from that particular, those 3 years. But the data over the past few years actually has been disappointing. The most common cause of death in this country is cardiovascular disease. If you put cardiovascular and cerebrovascular disease together, it is by far the most common cause of death and morbidity and mortality for the population. You could put the rest of the causes of death together, like cancer and trauma, and they would not equal that of cardiovascular disease. In the African-American community, it is the leading cause of death. Between 2017 and 2020, almost 59% of Black males and 59% of Black women greater than the age of 20 had some form of cardiovascular disease, including coronary disease, stroke, and hypertension. For data that we actually have available to us from 2022, almost 65,000 Black men died of cardiovascular disease, and almost 59,000 Black women died from cardiovascular disease. The incidence of hypertension in the population in total is about 47%, but in the in the Black community, 57% of men have hypertension and 58% of women have hypertension, which is the leading risk factor and cause of heart disease and stroke in the population. The stroke-related death rate for Black men is almost 64 per 100,000. For Black women, it's over almost 60 per 100,000, which is the highest of all our racial and ethnic groups. The incidence of hypertension, diabetes, and obesity in the Black community is significant. It's greater than 50% across the board. So the risk factors that lead to cardiovascular morbidity and mortality in the population is high in our community. Which actually speaks to an even greater opportunity for actually how do we reduce these particular risks and hopefully reduce the incidence of death and morbidity from these particular maladies.
All right, you've given us a lot of numbers and you've given us a lot to look at. Dr. Regina Benjamin, would you like to add on to this?
Sure. Like today more than ever, it's so important for us to come together like we are right now. The roles that each one of us have are increasingly important for our patients and the communities that we serve, particularly the Black community, especially now with the rules and the healthcare landscape changing every day and sometimes several times a day. All of that makes the work that you do and the work that I do as a board member of American Heart Association and what the American Heart Association is doing so important. And just those numbers that Dr. Churchwell had just gave you is staggering, and we certainly need to improve them. Quality and improved health outcomes depends on having the right information, the right tools, the right devices. We talked about technology like telehealth, our watches, our wearables. All those things are important in getting information out and having people controlled and understand their health care. But it also depends on us being able to communicate with our patients. It depends on our patients understanding us, and more importantly, us understanding our patients. That's why we really need your help. Back when I went into office, access to care was at the forefront of the public discourse, and sadly, it's there again.
Mm.
We've learned a few things. We learned that to truly reduce and ultimately eliminate health disparities, we'll have to address those social determinants of health, such as poverty. And studies have shown that poverty and dropout rates are at least as important a health problem as smoking in the United States. And we can't underestimate the importance of education. The United States death rate for people with less than 12 years of education is 2.5 times higher than those with 13 more years of education.
My goodness.
Your financial health is directly related to your physical health. Almost 50% of adults have at least one chronic condition, such as diabetes or hypertension, strokes, behavioral and mental health issues. And as all of you know, I'm a longtime champion of the power of prevention, and prevention is the foundation of public health. We have to help people understand that staying healthy also depends on other factors that influence our health, like housing and transportation, education, the availability of quality, affordable food, our workplaces, and our environment. And like Dr. Churchill said, nothing's made this more clear than COVID-19 did in the Black community.
Yes, ma'am.
We have to make prevention a part of our everyday lives and empower people to make better health choices.
If I may, Dr. Churchwell, I'd love for you to follow up on what Dr. Benjamin has said and about witnessing the systemic inequities that are part of cardiovascular health outcomes, and especially as it relates to the Black community. And what strategies are you seeing that are being used to address these inequities?
So the issues around the social drivers of health that Dr. Benjamin eloquently sort of detailed are incredibly important. The data shows that probably 80% of actually the impact of health is actually around these particular issues, not the day-to-day issues around your overall disease state or actually your interaction with your particular provider. So having an impact in terms of that in the communities that we serve around these issues, in terms of our education, transportation, the inequalities around the overall of commerce are incredibly important. What we can do, I think, is actually work within our communities as with those who actually have a great interest in this, as with terms of local government, other organizations that actually have expertise in these particular areas, and think through how we can put together plans and operations that actually affect it. The AHA thinks about this, I think, in a couple of different ways, and Dr. Benjamin may chime in on this in terms of thinking about the overall pipeline. Pipeline meaning how do we actually grow the number of within our communities of providers who actually look like us and actually are from and have the experience of actually working and living in these particular communities and have probably a better understanding about what can work and what should work in terms of improving our overall health. And AHA has worked towards having an impact actually starting in high school from a mentoring standpoint, from an observational standpoint, of bringing these individuals to our scientific sessions, but also a mentoring program so that actually they have examples of those who have been successful in the field and actually work towards pipelines for our physicians and our physician scientists to actually address these particular needs. Another way that AHA has approached this is actually within the communities, actually investing in organizations and companies that are trying to affect change around the issues of education and commerce and food and transportation that actually can support the communities in better ways through the Bernard Tyson Fund and through our venture funding, which I think is incredibly important. That actually should have legs over time, because that investment will actually let the communities work towards finding solutions for themselves, along with organizations and medical institutions in their communities to actually bring solutions to the table. And also thinking about the science that actually surrounds this, a better understanding in terms of what works, what doesn't work from a medical standpoint, from an operational standpoint, so that we actually have the best and most precise pathway of care that is going to instill a better opportunity to improve the overall health of within our Black communities.
So, Dr. Benjamin, you not only, as Dr. Churchwell has talked about, but you are in the boardroom as well as in the examination room through your clinic. And so what strategies have you found in your particular practice or in your community that work in combating health and misinformation and the disproportionate care and conditions that affect people, Black people?
You know, I can talk a lot about what we're doing at AHA, but Dr. Churchwell kind of went through a lot of it. But in my practice, we have to make sure that we listen to patients and we understand where they're coming from. For example, this was before GLPs and stuff. I thought I was doing a really great job of had a family, her and her husband were obese, and I had them exercising, losing weight, and they were doing a great job, and I was proud of myself. And then she came in one day and says, you know, Dr. Benjamin, we just can't do this anymore. Me and my husband, word on the street is we on crack because we're losing so much weight.
Oh my God.
We have to understand where people live and what their circumstances are. And so I had to kind of deal with everything that way. If you don't know where people are coming from, you can't really get them to change and that sort of thing.
That is incredible. Dr. Churchwell, we're going to close this out with you and you sharing a story of a patient experience and highlighting, as Dr. Benjamin has done, that may address the unique needs of Black patients.
Yeah, well, I'm not sure I can top that story.
Well, we're not asking for toppers, just.
But I come from this maybe from a unique perspective, from a clinician and a physician cardiologist, and also from an administrator from a hospital and heart institute perspective over the past generation or so. Seeing patients actually within the clinic who have insufficient funds to pay for the medicines that I actually prescribed, and actually dealing with it as we go forward. But also, most recently, putting together plans and operations to address issues around hypertension, and then finding out within my own medical community that the grand majority of patients being seen in the New Haven emergency room for malignant, or it's called very high hypertension, hypertension that could lead to hospitalization, and hypertension that could lead to actually stroke and actually heart attack, were actually employees of the health system, who are black men and Black women who are employees of the health system, who are actually being seen in our emergency room, not just once a year, but twice a year, 3 times a year for the same problem.
Oh my.
So understanding where people live, understanding what their needs are, and actually trying to channel our efforts to actually address those needs in a much more aggressive fashion, so that at the individual level that we are applying what we know and what is effective in terms of therapy in a way that actually can have an impact on lives, I think is incredibly important. But that's basic understanding of where we are and what the needs are is going to be key in terms of us being able to bring solutions to these problems.
That's a wake-up call, Dr. Churchwell.
Sybil, I know we're running.
It was not my best meeting. Let's put it that way.
Wow.
In regards to actually let me rephrase that. Not my best meeting in terms of thinking that we were doing well, but a great meeting and actually working towards a better understanding about how we can apply the science of what we have learned to a greater application in terms of the needs for the population to a much greater degree.
And Dr. Benjamin, I'm sorry, I didn't mean to cut you off there.
That was worth it. You know, I know we're running out of time, but I want to just give you a positive things, what we can do. We know things like exercise and eating well works well, but we need to encourage people to just do things that are fun and enjoy it. You can exercise and have fun. You know, dancing, for example. We used to, I guess, what is it? Used to do the electric slide, but now we've got,
right?
and now we've got my boots on the ground, you know, put them bands out.
Come on.
And so you can go and exercise and have a good time and still have community and enjoy, but be healthy at the same time.
And just one point, and I know we've got to run. That's an incredibly important point, Dr. Benjamin, coupled with the fact that in this day and age, we have actually a multitude of medications that are actually cheap and effective to treat these particular diseases, these maladies of hypertension and diabetes, and working towards what we can do for obesity. Working on efforts to actually address the needs that actually really are much more effective for the individual in terms of what they can afford, but also from a lifestyle standpoint, what makes sense for them is actually an important part of the conversation we have to have with our patients.
Dr. Regina Benjamin, America's doctor, and Dr. Keith Churchwell, the heart of the American Heart Association. Thank you so much for joining us, and stay tuned with us as we continue our conversation. Let us move forward, and we're going to have a little bit of information with a poll question for you folks. Let us, I'm not sure if we are on the same page there, but let's talk about this video that I want you to see. 2 years ago, the world witnessed Damar Hamlin's collapse on the football field. The world saw this as he was in the middle of a football game, Monday Night Football, as a matter of fact, and the power of the chain of survival that saved his life. It was about the people who were around him who saved his life. This moment was a catalyst for change, and Damar Hamlin has been a captain of that, as reinforcing the urgent need to equip more people with life-saving skills. So today, the American Heart Association is rethinking how we can engage our communities and moving beyond the awareness and action. And through our partnership with Damar Hamlin, we're turning a nation of bystanders into a nation of lifesavers. Let's say that again, a nation of lifesavers, ensuring that more Black families and communities have the knowledge and the tools to take health into their own hands. And let's take a look at what Damar Hamlin, our hero, has to say.
If the time comes, be ready. Learn CPR and join the nation of lifesavers. Nearly 3 out of 4 cardiac arrests that don't happen in hospitals happen in homes. CPR saved my life. I've teamed up with the American Heart Association as a national ambassador to help create a nation of lifesavers, turning bystanders into lifesavers through CPR education and access to AEDs. Join me to ensure everyone has the chance to live longer, healthier lives. Visit heart.org/nation.
That's powerful right there, right? We're talking about a nation of lifesavers. I have taken the CPR courses, and I feel confident that, you know, if an event should happen in my home or on the street, that I might be able to help someone in starting and knowing how to start the whole process, as well as to get someone on the phone and let's get this started and helping someone's life extend. Nearly 70% of cardiac arrests that don't happen in the hospital happen in our homes. That's what I'm talking about. And that means that the life you may need to save is likely to be a loved one, a girlfriend, part of your village, if you will. And unfortunately, only 40% of the people will receive help from a bystander, and that number is less for Black and Hispanic or Latino people. But there is good news based on the new data. from a nationally representative survey of U.S. adults, the American Heart Association has found that 39% of adults are confident to perform CPR in the U.S. right here. And that is an increase from 33% just 4 years ago. And that equals to a whopping 17.7 million more people. We are a village that can help extend the lives of our village members. The success of the American Heart Association Nation of Lifesavers initiative is due in large part to you. That's our media friends who have shared the importance of learning hands-only CPR through your channels. This shows us the power that we have when public health and media collaborate to improve the health of our communities. This is a perfect segue for our next group of panelists. I'm very excited to have this wonderful group of people. And let's start with the Dean of Black Journalism. Dr. Benjamin Chavis is currently the president and CEO of the National Newspaper Publishers Association, and he's also an adjunct professor at Duke University teaching environmental justice. This longtime civil rights leader is a former NAACP president and CEO and a lifetime member of the NAACP. And Dr. Chavis also has a syndicated column as well as a PBS show that is called The Chavis Chronicles. Dr. Benjamin Chavis, it is a great honor to welcome you. Thank you so much for joining us today.
Well, thank you very much, Sybil, and I'm very pleased and very grateful to the American Heart Association for making this possible. The issue of media, the issue of messaging, the issue of our narrative as a people, as Black people, as the Black community. How do we not only know the importance of health, but how do we communicate with one another?
Yes, sir.
To assure that everybody in the family, everybody in the neighborhood, everybody in our networking, I was telling someone yesterday that, Black Americans, we're not monolithic. There's diversity within our own community. However, there's some underlying things that ties us together, and that's public health. If you look at what happened at COVID, it exposed all these pre-existing conditions in our community. I think we knew they were there, but not in a focused way. Right. Now, I think we have an opportunity. That's why I think while we, on the one hand, we list all the maladies, all the things that challenge us, but I'm hopeful that we can overcome some of these things by working together, getting out some of the facts that Dr. Benjamin and Dr. Churchwell have just shared. And I'm pleased to have this panel with April Ryan. She's working with us now at the White House. We got a team of specialists, journalists who are ready to take this information today and widely distribute it over and over again. Last point, we have found in the Black community, one-shot messaging does not work. Mm-hmm. We have to repeat our messaging over and over and over again in order for it to be sustained in our consciousness of what we should do to make our health better.
Absolutely. Thank you so much, Dr. Chavis. And speaking of which, the queen of all media, as I like to call her, the longest serving Black woman to serve in the White House as a White House correspondent is the award-winning April Ryan, an author, covering urban issues from the presidency for over 26 years.
28.
I'm sorry, 28. You're right. You just had your anniversary. Congratulations. She is the Bureau Chief for Black Press USA, an NAACP Image Award winner. And she is just one of those people who's very passionate about putting out the information and giving it to our people. So April, thank you for joining us today. And also want to welcome in my friend that I work with on a regular basis on the Willie Moore Jr. show, Cherie Nicole. She is a journalist and extraordinaire, as well as a co-host of the Willie Moore Jr. syndicated radio show, an athlete herself, and bringing in a lot of different areas of her life into this discussion. So ladies, thank you so much for joining us. We appreciate that. So how do you, let's talk with you ladies and Dr. Chavis, how do you perceive the media's responsibility in delivering? So how do you perceive our responsibility in delivering accurate health information to Black communities? Let's start with you, Cherie.
Keyword is accurate. And I think we're in a time now where social media, a lot of people are getting their information that way. And, you know, also a lot of people don't double source things. And so we're now battling a generation that very much wants information, but doesn't necessarily know how to substantiate it. So I think, as Dr. Chavis was talking about, we need to continue to repeat the message. So first off, we need to make sure what we're messaging is correct. And then we need to continue to repeat that. That's one of the bigger things. And I also think we need to be exemplary of what we talk about. I'm reading this book right now called Let Them by Mel Robbins, and she talks about you can't change people, but you can exemplify before them the change you want them to make. And so, as we're also in the media space and we're providing this information to people and explaining to them the pros and cons of different behaviors and lifestyle changes that they may need to take on in order to be preventative, as Dr. Benjamin talked about, and take their health more seriously, we need to model that before them. A lot of my colleagues, and I do this as well, you know, I show workouts that I do at the gym on social media. I'm showing you I'm in this too. I'm never gonna implore you to do something or try to educate you around something that's I don't take seriously as well. So I think we need, from an internal standpoint, to take it seriously in our own personal lives, but at the same time understand how important it is for us to ensure that what we're giving is truthful and consistent. And I think we're still trying to figure out the consistency of our messaging, but once we nail that down and work cooperatively, again, as Mr. Chavis talked about, I think we'll be in a much better state as we move forward.
Excellent. Let us move to you, my friend April, and talk about the responsibility that you feel in order to break, because you are the epitome of what we seek, and the epitome of what we admire in giving out the information to our people.
Well, thank you for that. And this has been a great panel so far, and I'm really taking it in myself and also wanting to impart some information. We are in a moment right now. The imperative is there for us to educate and inform Black people about your health. As we are watching those who are being confirmed, who don't believe in some of the things that we believe in, we have to really take this moment seriously. We have to listen to these types of programs. We have to advocate for ourselves. We have to talk to our doctors, because it is important. This is some of the things that we as Black press need to talk about, because think of this moment right now. There are 7 airborne illnesses out here in this nation right now. The flu, COVID, so many other things with these long coughs, but you're not hearing about it. And if it weren't for us in the Black press, we would not be knowing that that was out there. Yeah. And, you know, Dr. Benjamin, we were just hearing from her. I'm going to have a conversation with her later on to talk about this lack of information when it comes to us and our health, particularly about our heart, especially when we get to those certain ages. Me as a woman, going through that myself, you know, you go through cholesterol issues and heart issues in medicine. It's very important that we know this, especially listening to the numbers. And as Dr. Chavis says, this is not a one hit. We've got to continue to say it over and over again. We start here with the American Heart Association and the National Press Club, and then we do another story on it. And then we continue to do the stories, follow-ups, etc. This is an important moment for us as the press to put it out there, because still we are the community with the highest numbers of negatives in almost every category. And when it comes to health, it's deadly.
Ooh, powerful. Dr. Chavis, you've been in the weeds. You've been in the all of this from the ground up in terms of community action and reaction. So let us turn to you as the dean of action in our community, and how can community leaders and media professionals work together to identify and correct misinformation within the Black communities? Because as Cherie has said, you know, we are living in a society where we want our information quickly, and we're not doing our due diligence to verify this information. And there's a lot that we have to verify. So Dr. Chavis, how do we work together to do this?
Thank you very much. I think there are 3 things. One, this program exemplifies what the first thing we need to do. Let's work together. The American Heart Association, the NMPA, Cherie's program, Sybil, what you do, we all need to work together. I think the consistency of our message needs to be a point of consideration. Then number 2, I'm very concerned about our young people. You know, I think the average age now in the African American community is 36 years old or younger. So you got a lot of young brothers and sisters out there who have heard about the civil rights movement, heard about how we struggle and how we fight for freedom, justice, and equality, but they're also vulnerable to a lot of misinformation on social media, a lot of disinformation.
Right.
And so we have to create a trusted source of the delivery of that information. Then lastly, the science. I'm so pleased that Dr. Benjamin and Dr. Church were on it, because let's be honest, we live in a society where there's denial of science. They deny climate change. They deny environmental exposure. They deny racism. They deny discrimination. And they come with all these schemes to try to make us feel like there's something wrong with us when we demand freedom, justice, and equality. There's nothing wrong with us. There's something wrong with the system that denies us freedom, justice, and equality. So those three things, in terms of working directly with the American Heart Association and others, I think about the National Medical Association, I think about National Association of Black Nurses. We all need to come together and protect our health. And I also agree with being preventive. There are a lot of things that can be done to prevent some of these maladies, and that's what we need to focus on.
Prevention, absolutely. Ladies, you all are out there in the field. You are doing all the good work to bring information to people. Can you share a specific instance in your reportage that brought attention to the health disparity affecting the Black community, especially that is tangible to change and that is open to the possibility of our helping these things to change?
COVID. Remember COVID?
It's a tie. I was going to say the
Yeah.
same thing.
Yeah, I mean, that's when, again, we found out that when we had these underlying issues, and the vast majority of us, as we've heard from the previous guests, we have these. And the Black community was susceptible to lack of doctors, lack of care, lack of testing, lack of just care, being able to get into a hospital. And we passed away, we perished. And that was one of the biggest moments where it opened my eyes as to the lack of good care, the lack of good health care. We were hearing about hospitals having people in the hallways. Many Black people were in the hallways, unfortunately, and didn't get attention, did not get the life-saving attention they needed. And this is one of those moments, in my opinion, because we're not hearing about the viruses or the dangers out there right now that we need to be paying attention to. I mean, how many of us actually really listen to the statistics to know that Black women have a higher propensity of heart disease and death than the average person? That is a really big deal, because Black women are the women who hold the household together, who hold the community together, who hold the church house, the schoolhouse, and even, yes, the government house. So we are relied upon, and yet we are those who are very susceptible. And what are we doing? Yeah, most vulnerable. And where are we getting our health care from? The emergency room. We need to get to our doctors, get the primary care doctor that we can trust, that works with us, so we can move forward. And even nutrition. I love those things. We talk about it, Sybil. We talked about it. I am susceptible. I'm one of those women now. I'm fully transparent. Menopause hits, and you have cholesterol issues. You have different issues. And I had the best cholesterol in the world. And now I'm like, wait a minute. I've shifted my eating habits. Instead of rice, it's cauliflower rice. Instead of fried chicken or fried catfish, I'm baking salmon, which is a little bit costlier, baking cod, doing things heart healthy, making sandwiches out of, what is that? Chia seeds. Don't ask out. I gave Sybil the recipe, but trying to do things to stay around, because I am the key, the linchpin in this house, and I want to be here.
And if mama ain't happy or mama ain't well,
yes,
none of us are.
Right. And that's why I want to be here. And this is why I appreciate this conversation. I appreciate it on twofold: as a journalist, to give information, but also to receive the information to stay alive.
And so I hear you amening this, Cherie. What
Yeah.
about your life? And we're giving you some things to look forward to in your upcoming years. I know, yay, menopause.
All right.
But
No,
I'm
don't say
so
yay. But go
I'm
ahead.
so excited, Sybil. I can't wait.
well, let's get you to making those babies first. But there
Right.
is a possibility that what you are doing on a daily basis through Essence Magazine, through the Willie Moore Jr. Show, that you are extending and get information to people, but as well, you are getting information back and examples of how your work has made a difference.
I love the points you make, Sybil. And one of the things, and I'll hit COVID just for a moment. For me, it also showed me that no one is exempt. And I'm really enjoying the conversations that have been had before our panel and also what we're having. This is a cross-generational conversation.
Yeah,
we all are coming and representing different generations. I'm 38 years old. I have a history. I have a family history of high cholesterol. So I deal with that now at well into my 30s, something that, as you mentioned, April, you didn't have to deal with until much later in your life.
Yeah.
And so I also have a very close friend who had a massive heart attack in her early 30s. I saw people that I went to high school with or college with battle through COVID. We're talking about, again, people in their early to mid 30s. And so it speaks to, from a cross-generational standpoint, we all should have to start this. These aren't issues now that are anomalies when a young person has a heart condition or when they have a heart attack or something happens. This is something that's happening in my generation. I'm a millennial, that's happening at a rapid rate that we're also not necessarily paying close attention to. I think as a journalist, it's important for me to uncover some of these stories and explain to people, this isn't an anomaly anymore. Like, based on our lifestyle habits, based on our eating habits, this is a very, very real thing for all of us. And it's not to scare you. It's just to let you know you can't walk through life, even if you're in your 20s or 30s, like you're exempt from these issues.
Right.
One of the things I think is important is to make sure that you align. I have a lot of older friends. I just do. But hearing about things like perimenopause and menopause, for example, aren't conversations that I'm not privy to. We have them all the time. So I'd encourage people, even in my generation, start having conversations with people in your life. They could be your mentors, they could be aunts, your mother, whoever, grandparents, where you can start talking about what are some things in your family, in our family, that we've dealt with, just so you kind of armor yourself with that kind of information. I think it's really, really important. And then also, as media professionals, encouraging people to get accountability partners, encouraging them. Valentine's Day is tomorrow. We all talk about Galentine's Day, finding other twists and ways to kind of make going with a friend to the doctor, to your first doctor's visit, maybe in 3 or 4 years, popular. Like, we can set the tone in media to create these trends where people aren't as afraid and a little bit more excited about at least seeing where they stand so that they can move forward from there. So again, thank you guys so much for the opportunity to chime in and be a part of this incredible group.
Sybil,
Well, you're an important part of this. April, time is not our friend. So go ahead. I'll give you this.
just really fast. We have to, as the press, as Black press, and as the press period in general, we have to remember, as they flood the zone out there, we have to keep certain things priority. This is a priority issue. This is life and death. This isn't something cute. This is life and death in a community, again, that has the highest numbers of negatives in almost every category. When it bleeds, it leads. This is bleeding. Important.
Yeah, and bleeding profusely.
Yeah.
Dr. Chavis, I'm going to give you the last word. And my question is, healthcare organizations collaborating with media outlets, how can we best do this to ensure that we're putting out the most important information and actionable health information that we need to act upon?
Well, I think there have been several references to technology. I think we should be using whatever technology is available to us to disseminate the facts. Like today, we are live streaming this on YouTube through blackpressusa.com. And we're going to continue this discussion even after this symposium. I would say, in short, because I know time is with us, we have to understand that this life and death situation with our hearts is the most important health factor that determines our future, impacts our present. We should learn from our past. And that way we need more brothers and sisters going into the medical field. We need more of these collaborations. I'm so thankful that the Black Press and the American Heart Association are going to work together.
Absolutely.
So I want to end on my part on the optimistic we have always risen to the occasion as a people. And I agree with April, we shouldn't get totally distracted because every hour something else happens.
That's right.
That takes our attention away. But on this, our heart, nothing should take our attention away from the health and the goodwill and the repair and restoration of our heart and our community. So rest assured, the Black press is going to continue to drill this home, report on it, and get the data. I think what the two doctors said is very important. It's not only having the data, but it's the interpretation of the data and how we communicate the interpretation of the data to our people who are hungry and thirsty for the information that's accurate.
That from the media mogul himself, Dr. Benjamin Chavis, and civil rights pioneer as well. And thank you, ladies, for joining us. My sister's on the mic. I appreciate you. So let us move to a question that we have for folks. What percentage of Black adults have hypertension or high blood pressure? Let's talk about that question. As we prepare, we are going to have bring back some of our guests, the doctors, Dr. Keith Churchwell and Dr. Regina Benjamin, as well as Katrina McGee, joining us in just a moment. So let us bring back our guest from earlier in this program. And we talked about the state of health in Black communities and how the media can help to drive, to change and improve lives. And now let's welcome back Katrina McGee, Dr. Keith Churchwell, and Dr. Regina Benjamin to share some of the ways that the American Heart Association is driving forward and with a great impact on our community. Dr. Churchwell, if you are, we will start with a question for you. Can you share with us the answer to the poll question? What percentage of Black adults have hypertension, and how is the American Heart Association addressing that?
So I may have given the answer earlier when I gave actually my statistics, but I think the answer is C, and at 58%. I think that's what I'm seeing here. Which is a significant number. Think about that. Over half the population, half the Black population in this country, both men and women, actually have hypertension, have significant hypertension at this particular point. So that speaks to the widespread issue of this particular risk factor that could lead to stroke and heart attack, but also speaks to the opportunity that presents for AHA and also the medical field and population in general about how we can attack this and actually aggressively reduce blood pressure and reduce our overall risk.
Can you talk about the research that American Heart Association does, particularly as it relates to Black people? You have these numbers, but how is the research compiled, and can people be a part of your research studies?
We welcome that. We compile that research actually through our Get With Guidelines program, through our hospital associations nationwide. We also invest in actually discrete clinical trials and also research programs at the physician scientist level across the board, across the whole population, but specifically looking at the issues that surround the African-American population in this country and thinking about what can have a greater impact, not only in terms of just medication, but also what are the other issues within the social and fabric and framework of our day-to-day lives can have a greater impact in regards to decreasing our overall risk, our overall cardiovascular risk. You know, Dr. Benjamin again spoke quite well about the social drivers of health, but also thinking about within that particular framework, what can we do as an organization, but what can others do, and who actually are looking at this from a research standpoint, ideas and opportunities to actually address these issues and address them effectively.
Let's bring Dr. Benjamin back and talk a little bit about what you know as not only as America's doctor during previous administration, but also what you are learning and what you know on the ground in your office as well as in your community. So can you share with us, Dr. Regina Benjamin, some of the answers to the poll question, and I'm sorry, as a part of your being on the board of the American Heart Association, but you're also involved in the social impact funds for several years. And so what effect have you seen from that program, the social impact funds?
So as Dr. Churchwell said, American Heart Association is one of the largest funders of cardiovascular research in this country. It probably, I would guess, second only to NIH, if that's correct. But we get all of this information, and we've been doing a tremendous amount of research, and we try to translate it to the bedside. This is our American Heart Association's 100th anniversary, and we kicked off something called AHA Ventures, which is translating the science and research that we learned into action. And so we're investing in companies that deliver this cardiovascular and brain health solutions. And we have incubators. Part of that AHA Ventures is something we call the Social Impact Fund. It was developed after Bernard J. Tyson died and to address the social determinants of health. And we use capital to invest in communities. And these are community-led solutions. We invest in companies and startups that are with health and healthcare access, food insecurity, economic empowerment, and we give them either equity, or we take equity, or we give them loans or grant funding. And you see some of the most wonderful things coming out of these communities. For example, there's a organization in Florida called Care Ya Ya, is the name of it. It's basically a startup that's using clinical students, pre-health students, that we train them, or they train them, to be sitters in healthcare, take blood pressures, to be basically caretakers, and they can have a job, economic empowerment because when they're not in school, and the elderly and folks can have someone to sit with them. And it's a business model that serves the entire community. We have food security and type organizations that deal with healthy foods in the communities. So this has been very exciting to see that we're not just taking that research, we're also putting it into practice and doing it at the community level.
You've mentioned a name a couple of times. I think both of you have mentioned Bernard Tyson, a former head of Kaiser Permanente, one of the largest medical organizations. And we lost him at the much too young age. And at 60, I believe, back in 2019. We're talking about a man with all of the access that's possible, but for whatever reason, he succumbed to his heart illness. So let's continue to talk about some of the things that we are doing in terms of encouraging young doctors to get into the business, as well as other issues that are available, especially that are offered by the American Heart Association. So Dr. Keith Churchwell.
Well, can I mention something about Bernard? I was on.
Of course, yes, please.
I was on Bernard's board, and I'm still on the Kaiser board. And he was a board member for the American Heart Association. And he did die of a heart attack in his sleep, young person, which leads me back to the previous panel in saying that the younger generations are just as important, particularly those 30-year-olds who have young kids. What you do, the lifestyles and the things that you do with your kids really set them up for their future. So those of us who've already gotten older, we also want these next generations to be very healthy as well.
Absolutely. Dr. Churchwell, I know you concur with that. And I also want you to talk about the AHA Scholars and the purpose of that program.
Well, the purpose of that program is to invest time and effort and monies to find and to work towards mentorship and to help in terms of career guidance for students, residents, fellows who are on a pathway to be part of the medical community, both from a day-to-day clinical operation and also from a science perspective, to help them in terms of guiding them and along their particular path. I mean, one of the significant initiatives that AHA has put together really over the past decade are actually large grants for networks of institutions working on very large projects, hypertension, women heart disease, atrial fibrillation. But we've also asked that within that particular framework that they work coincide their work and work in association with whether it be the University of Michigan to go out into their community and find other institutions like historically Black colleges who actually are engaged in this work to work in combination with them, to align with them, to help in terms of growing the pie in the terms of the number of individuals who are part of their clinical trials who are in underrepresented communities, and also to help in terms of finding the right answers to these particular basic questions. So AHA has been very much engaged in terms of not only the science, but also the mentorship, and also thinking about the next generation of physicians and physician scientists who actually speak to a larger and more broader representation across the board so that we can ensure that the questions that we are trying to answer are answered for everyone.
And speaking of that younger generation and affecting and some heart issues that may affect them, this is one that came to me, Katrina McGee, in a program we did about HCM and hypertrophic cardiomyopathy. And I wonder if you could talk about that, Katrina, a bit, as well as some of the risks that are involved. We had two young men in Division I basketball who talked with us about that. And it's really interesting to see how they dealt with it, but also to inform people. And so if we could have Katrina rejoin us.
Sure. I mean, hypertrophic cardiomyopathy is the most common inherited form of heart disease, and it is the leading sudden cardiac reason for sudden cardiac arrest in young people, particularly young athletes. And that's why this month we are focused on Nation of Lifesavers, because we want to make sure our children, our heart, are safe wherever they are. And so I am especially pleading that we get the word out about everyone, at least one person in every household, learning CPR. But y'all, we need actually more than that.
Right.
We need our kids' coaches. We need the nurse at the school. We need to make sure the AED is there and everybody knows where it is, that the AED has working batteries. Across the country, you hear these stories of young people passing away because there is no one in their atmosphere when they drop from cardiac arrest. And so it is super important, if we want to protect our children, protect our homes and our communities, that we all learn CPR. At a minimum, learn hands-only CPR. Call 911, push hard and fast in the chest, and sing to yourself, "Not Like Us," because that has the proper per minute to do CPR. Seriously, it is a matter of life and death at that point, because the person is already dead, and we need a person to intervene. And we know that in African American communities, they are less likely to have a person do bystander CPR.
And be a part of the success story of our succession in life, because that is so very important. And you're right, it's important that more than one person in your office know it, because that could be the person that goes down. It's important that, you know, in your Girl Scout troop, in your church home, all of this. We've been to those churches, Katrina, where they have the great opportunity for healthcare or information and those events. That's really important that that you guys are doing such a great job in leading the way in a lot of these events, and just showing people how easy it is, because it's really not difficult, but the journey is long and it may be difficult, but it is so necessary.
Sybil, can I make one point? Well, 2 points. Number one, Katrina, incredibly impressed upon your knowledge of hypertrophic cardiomyopathy. That was actually very, very good. But number two, Sybil, to go back to your point about the CPR and the need for actually more than one person in the family to know. A recent study that came out actually in Circulation, which is a major journal for the American Heart Association, showed that number one, we've improved the bystander CPR across the country significantly, which is the good news. The bad news is that the group who least likely will get CPR, bystander CPR in this country, are African American women.
Mm-hmm.
So it's the knowing how to do CPR is incredibly important, but we actually also have to to think about and work towards the solutions of why that is occurring. What are the hindrances that are happening within our homes, within our work places, actually on the street, that's not allowing us to actually do something that is life-saving for each and every individual, especially, but the least group who actually is getting this particular CPR to be done is actually African-American women. So that's a huge opportunity for us to actually get the word out and actually sort of how we break through that particular barrier.
And that's why when we came on today, Katrina, we were saying, you know, call your mom and them, call Papa, call Amy, call your line sisters, call all the folks that you think need to be a part of this discussion, and join us in this fight against heart disease, especially within our community. I want you to as we continue this conversation, Katrina, as the Chief Marketing Officer, what are your hopes for the American Heart Association as we encourage people to engage and to empower our people and work within the community, but especially us in the media, to become champions of heart advancements and heart health?
Yeah, I think, you know, the AHA's vision is advancing health and hope for everyone everywhere. And that requires a multiplicity of voices to bring that to bear. You all talked about it in just the previous panel about how important repetition and consistency is. We have to keep our foot on the gas. So you can't lose the lessons we learned in COVID and feel like everything is fine. It's not. Black people are still dying across the country from heart disease. And so what I would say is partnerships are king. You know, we need each other to survive. So in the example you just used about CPR, wouldn't it be fun for some of our newspapers to bring together churches across the city to say, hey, we want to move the needle in the number of people learning CPR in our community? Wouldn't it be great for the newspapers and the mayor and the community organizations to come together and say, this is our focus for the next 2 weeks, that everybody who intersects with the life of a child learns CPR? How powerful would that be if we said, yes, I'm down to do that. I'm down to be part of that solution, because in the midst of chaos, we have to be the place that is calm and clear and issuing that clarion call. As a matter of fact, since we have all y'all in the chat, I just need you to drop yes in the chat on YouTube so I know you're in, because this really is life and death in the moment. When a person goes down in cardiac arrest, you only have just a few seconds to start CPR. And yet we know in places like New York, EMS is 12 minutes out. If there is not a person right there, that person is not going to make it. In other places, people literally are not trained. And you hear me passionate about this because, y'all, I really want every mother who goes through Lamaze classes to also learn CPR, every father to learn CPR, as our children are raised, to make sure their teachers in the classroom know CPR, the school nurse knows CPR, because we have found out they don't all know CPR, and that we refresh it all the time. So the resources are there. It is super simple to learn hands-only CPR. We can give everybody the video to at least watch it, become more aware, learn the basics, because this is how we can change the tide on those particular disparities in our community.
Virginia, can you say one more time, where can people get this information? What is the website where people can get the training? Is there an online training for CPR?
Absolutely. If you go to heart.org/Nation of Lifesavers, you will have everything you need. You can find the hands-only CPR video. You can find where you can take an in-person class if you would like to do that. And you can also connect to where people can get with their local AHA organizations, because it's your local AHA that's already going to be partnered with the food bank for addressing housing insecurity, have resources in your community that can teach CPR in your city. So we want to make sure you connect locally so that you all can amplify each other's work.
And Katrina, here's the other thing, Katrina, that I think that people don't know that they can be a part of the change. your organization can call upon, and we can get people to come and to give us the CPR training class, right? We did it at our yoga studio in Fort Worth, Texas. You can do it at your Boy Scout troop, your Girl Scout. Well, they might be all together now. But the point is, wherever you are connected and with an organization, you too can connect with the American Heart Association and those instructors regarding CPR training.
Mm-hmm.
And I was going to say that in addition, Katrina talked about having a community event. You can also add on top of that some fun things, back into the dancing and stuff. You can have classes to show, teach people like me how to do the crip walk that Serena Williams was doing. I hadn't learned that yet. So, but make it fun.
100%.
And we're going to put that on your resume, Crip Walk Expert, Dr. Benjamin, so that you know.
See the headline in our newspapers.
That's right.
Crip Walk Healthcare.
Well, thank you all so much for joining us. I want to give you an opportunity, Katrina and Dr. Churchwell, if we have not given something or something that you wanted to leave us with. Dr. Churchwell?
Thanks, Sybil. It's been a very good conversation. And I think the point of emphasis that there is a great opportunity for the public as part of this conversation to learn about not only CPR, but the understanding about their overall risk for cardiovascular disease. One of I think an important thing they can find on the heart.org website is something called AHA's Essential Eights. And the Essential Eights is a little diagram, a little circular diagram that actually gives each and every one of us information about details about what they should be looking for and how they can help assess their overall cardiovascular risk. It talks about the fact that you should know your numbers, know your cholesterol, know your blood pressure, know your blood sugar, know the impact in terms of body weight, in terms of your day-to-day life. Know about your day-to-day exercise, the need for exercise, and how much you are exercising, how you can try to work to integrate that into your day-to-day life. And which is new for the Essential 8, which used to be the Essential 7, is actually a better understanding about your sleep pattern. Mm-hmm. And understanding that actually sleep is really important for your overall general health and particularly for your cardiovascular health. So we talked about actually using these particular tools on the internet, and heart.org has that as detail, and you can use that to evaluate where you are, and understanding about what you don't know and how you need to communicate to your clinician and to your providers about what you need to know so that you can put a plan in action about how you can improve your overall cardiovascular risk.
Thank you, Dr. Keith Churchwell. And we're going to bring everyone up and give everyone an opportunity to close out this conversation. And I will just share with you that changing the future of health for Black communities requires what we are seeing here today, which is bold vision and a tangible action plan. And as leaders, you've already done that a great deal. So what is the future focused concrete step that you're taking or plan to take to drive meaningful change to help contribute to a healthier, more equitable future for Black communities? And Dr. Chavis, you are a great example of that. Is there one thing that you want to lead us with?
Yes, I want to announce that the National Newspaper Publishers Association will make this one of our highest priorities in terms of news reporting, in terms of editorials, in terms of advertorials. Look, this is key, not only in our print publications, but our digital distribution and our online publications. Health, not only in February, but for all 12 months. Right. We cannot afford to lose a day without focusing on our healthcare. That's
right. Your protege and your newest employee, April Ryan, is co-signing. April, what would you like to leave with us?
One, I am very interested in, as a singular person, not as a news person, doing some of the things that were just offered, having something, a bunch of my girlfriends in my home and learning to crip walk and also learning our cholesterol numbers, because there are kits actually in our local pharmacies and stores that do your cholesterol checks. I want to do those kind of things, like a fun little girls' night where we can do that. But then when it comes to news, I'm standing alongside Dr. Ben Chavis. I will definitely make sure, because again, this is imperative. This is life and death. We are a community with the highest numbers of negatives in almost every category. And when it comes to life and death, this is so important. And like you say, sleep. Let's do stories on sleep. Let's do stories on cholesterol. Let's do stories on wholeness so our heart can be healthy.
Thank you so much. Dr. Regina Benjamin, we're going to give you your last word, and perhaps I'm not sure if we have activities to go along with a crawfish boil, but perhaps you have something for us, Dr. Benjamin, to share with us.
Yeah, crawfish boil, shrimp, whatever. It's the same. I just hope that you will all continue to join us as we continue to beat that drum of prevention. The American Heart Association has been beating that drum of prevention for the past 20 years, and we want to continue it so that we can be prepared, so that if something happens, whether it's a outbreak of an infectious disease or a foodborne illness, our community is prepared, so we can do everything that we can. And then the last thing is just remember that it's never too late to start improving your health.
Mm-hmm. Absolutely. Cherie Nicole.
I would say from a personal and probably a professional standpoint, the change that I want to see starts with me. So I just want to make sure that I'm exemplifying the things that I'm, informing people about what they should be doing to prioritize their heart health and health overall. And I just want to encourage anybody that's watching, it's okay to have fear. It's something that we all deal with when it comes to our health. And I think April was talking about this earlier, just in our community and specifically in the Black community, it is an issue. And so I think we need to be realistic about that emotion. And so I'm giving you permission right now to accept that's where you are, but you don't have to stay there. So I just want to encourage everybody, move your body, and you don't have to go to a gym and clean weights around. Get out for a walk, develop new healthy habits, and they can be very simple. For some of us, it's just simply getting off the couch for 15 minutes and just walking with a friend or walking your dog. So as Dr. Benjamin even mentioned, it's never too late. And I don't want you to think that there's extravagance and difficulty to simply taking the first step. And as a journalist, I will be doing a much better job of encouraging the first steppers. I'm good. I'm good with the ones that are already moving and grooving and running and all that good stuff. I see you guys. I love you. I'm still going to talk to you, but I'm going to reprioritize who I'm speaking to more directly. So to all the first steppers out there, I got you, and you're going to be of high priority for me moving forward.
I don't know about you, Katrina McGee, but I'm ready to join Team Cherie as well as Team Dr. Benjamin, Team Dr. Churchwell, all of those folks, and Dr. Chavis as well. I just want to just kind of recap here, Katrina, as we close this out, and some of the things that we have talked about and some of the suggestions that people have made in terms of working together. And being a part of an organization, being a part of our community, bringing folks together, as well as to be consistent. That's why we need those partners that are going to hold us accountable to doing better. Because when we have people and we can encourage them, and those days when we're not up to it, hopefully our partners will be up to it, right? And we'll all be able to keep moving and grooving. Also to know our history. That is an important thing that Dr. Chavis talked about. Just knowing our medical history, Dr. Benjamin, and knowing how important it is, but also our collective history, in that we have been shut out of a lot of these things for so very long. And now we have the opportunities, thanks to the American Heart Association, to really be inclusive in this and get everyone's hearts going and have this journey be a part of our collective journey.
Absolutely. Sybil, there were so many good nuggets. I mean, like, I am I got a page full of notes here myself. And if you don't mind, I just want to share a couple of them.
Please.
Because I think they would make such rich stories. Dr. Chavis, first of all, thank you for saying that this is going to be an all year 365 approach, because that is what it will require to live longer, healthier lives. We talked about joining the nation of lifesavers. If you have a moment to hero people who have performed CPR in your communities, families that have been impacted, that is what most resonates and inspires other people to learn CPR. So across the country, I would love to see those stories told and amplified in our newspapers, on our airwaves, on television, and in social content, because we know practically, whether we like it or not, people are going to the TikTok doc. They are getting their health information from social media. So we have to intentionally put out the good nuggets and the truth so that they can access the information they need. The second thing is, I love that we talked about prevention, y'all. Can I just say amen to Life's Essential 8 and the need for sleep and less stress and knowing your numbers and all the things, and to having fun. Oh my goodness. Part of the reason we don't eat good is because we have lost, the taste of joy, that communal eating, the way we all get together and it's a part of who we are, and we have folks over and we kiki and giggle for no reason that it's a random Friday night. And if we can get back to some of those things in a healthy fashion and dance and move our bodies in a way that is natural to us, health will be a part of our life and not just something we do on the side. So I believe that we can accomplish that. But talking about prevention on a continual basis in a way that is culturally relevant. Like, yes, the Mediterranean diet is really good for you. But if you are a person that eats greens and beans and all that, we need to know how to eat that healthy too. So let's just keep it real and resonant for our community. The third thing I would say is, you all talked about clinical trials, and the African American community has a long sordid history with clinical trials. We need to demystify clinical trials because, y'all, what is happening is drugs and new interventions are coming to the market, and we have not been part of the clinical trial. We have no idea how this is going to impact us if we don't participate. And so at some point, I think we need to get a group together to have a candid discussion about that so we understand what clinical trials are, what you can expect, and why it is so important to advancing health in our communities. And then finally, I will say, there's a proverb I love that says, until the lion becomes an author, the tail will always favor the hunter. We are at a precipice. We are holding the pen. We are in front of the mic. We have to be authors and change the narrative of our own health. And so you heard some scary statistics today, but hopefully you also heard some solutions, and you're just excited about joining us on this journey, being that beacon of truth with consistency and clarity, and calmly telling people how to move forward in their health. So many good nuggets. Thank you to the entire panel and to you, Sybil, for ushering us through this conversation. It has been amazing.
Thank you for the opportunity, Katrina. And I just want to, and like you, I wanted to echo. Sheree Nicole said, the line that we recognize: be the change that you want to see. And so we have to forge ahead and be the leaders in this, whether it is through our media outlets and our day jobs, or our out of job life, things that are happening in our day to day. This weekend, we had an opportunity to perhaps talk about it during Super Bowl weekend, but this coming weekend, when folks get together for the All-Star game, and we'll talk about some young Black men who have benefited from the American Heart Association and the knowledge as they have dealt with HCM and things like that. And we'll talk about that. I want to close out and just thank everyone who has been so very important and vital to this conversation, starting with you, Katrina McGee. Thank you for being the leader and showing us the way, as along with your partner, Dr. Keith Churchwell, who is the president of the American Heart Association and is the head volunteer for the organization, as well as Dr. Regina Benjamin. It's great to connect with you after these years as America's doctor, and you are doing great things. We want to thank you as well. Dr. Benjamin Chavis, you are the voice that we need, and we need it consistently. And you are doing it as the media mogul that you are with the Black press, as well as your young woman in the White House as a correspondent, April Ryan, and my friend is Sheree Nicole, who is also so very important on the ground there and on the Willie Moore Jr. show, as well as all that you do with Essence Magazine. You keep throwing those 3 pointers in, and we're going to get somewhere in this battle against heart disease. I also, I mentioned thanking you, Katrina. I'd also like to thank your staff Angela Collins, and Tracy Bertrand, and of course, Arica Kaysen. Thank you all so much for joining us. Don't forget, heart.org. That's where it all starts. The Nation of Lifesavers, and all of these organizations and efforts that are going on under the umbrella of heart.org. Thank you all so much for joining us, and we appreciate it, and we will see you again. Go out there, be good to each other, and be well. I'm Sybil Wilkes.